All right, welcome back. This is Chapter 3, Lifting and Moving Patients of the Emergency Medical Responder Program. Glad you're back, and let's get forward. Let's talk about lifting and moving patients. All right, so as an emergency medical responder, you're going to have to be able to analyze the emergency situation, also quickly evaluate the patient's condition while you're analyzing that situation, also carry out effective and life-saving emergency medical procedures. These procedures may include lifting and moving and also positioning the patients. So, general principles. Every time you move a patient, keep the general guidelines in mind. Do no further harm to the patient. Move the patient only when necessary. Move the patient as few times as possible. Move the patient, their body as a unit, so you're going to move them all as a singular unit. And also use proper lifting and moving techniques, and have one rescuer give the commands. Also consider these recommendations. Delay the patient or delay moving the patient if possible until additional EMS personnel arrive. Treat the patient before moving him or her unless the patient is unsafe. Do not step over the patient. You don't need to reach over them or step over them. That's always a hazard to yourself and also to the patient in case you fall. Explain to the patient what you're doing at all times so that you'll be able to eliminate some of their fears. Right, so keeping some rules of good body mechanics in mind is going to be very important, because the last thing that you want is to get injured on the job or while you're helping somebody as a first responder. The number one is absolutely you need to know your physical limitations. If this patient weighs 300 or 400 pounds, come on, that's outside of anybody's physical limitations as an individual. Other things that you need to keep in mind is keeping yourself balanced. Make sure you have a good firm footing and good footwear, period. You need to wear good footwear. Lift and lower the patient by bending your legs, not your back. I must tell you that I have had many friends in this industry that have injured themselves permanently, especially their back, and they are out of a job. You also need to try to keep your arms close to your body for strength and balance, and then move the patient as few times as possible. This is the recovery position. These are patients that are primarily your unconscious patient. They have not suffered any trauma. It's a medical kind of patient. They can be put in the sideline or recovery position. This is what you see here. This helps to keep their airway open and also allows secretions to drain from the mouth. I want you to take a look at this position. The upside knee or the upside leg is in a bent position. So the downside leg, or the patient's left leg, is in a straight position. Slightly flex this leg. This will allow them from keeping them from rolling flat on their face. If you don't bend this knee, then they're going to end up rolling flat on their face. Also notice that we've taken the right arm here, okay, and gently slid the hand underneath the patient's head. This also helps to keep the airway open, and it keeps them in that position because the way the head keeps their hand nailed down to the floor itself. But this is a left lateral recumbent position or recovery position. Okay, very important one to remember. And again, this is for the non-traumatic patient that you're not worried about the patient having some kind of spinal injury. Body mechanics. Improper lifting or moving techniques is going to hurt you. Plain and simple. You got to use good body mechanics. Use the strength of your large muscles. This guy's using the strength of his legs. Okay. Notice that his arms are in a locked position. He's using the power grip. You know, his hands, his palms are up, and his fingers are grasped around that backboard. So don't use your back muscles. He's standing very straight up and down. Okay. He's using his legs for his body mechanics. All right, so keep your back as straight as you lift. Lift without twisting your body. Ensure that you have firm footing before you start to lift or move the patient. And again, you need to be assessing the weight of the patient. Or is it exceeding your limitations to lift this person? Knowing those physical limitations are important, and get help when necessary before you lift to move these patients. All right, call for additional personnel, like we just mentioned. Communicate with other members of the lifting team. There should be one person calling the shots. Practice these lifts and moves often so you'll be very familiar with them. All right, so emergency movement of patients. So emergency movement, this is when we need to move a patient immediately for some reason. A lot of these reasons could be included danger of fire or explosion or structural collapse. Maybe there's a hazardous material that is present. The emergency scene cannot be protected, or otherwise it's impossible to gain access to other patients who need life-saving care, or the patient has experienced cardiac arrest and we need to get to a bigger area so that we can do CPR and defibrillate them appropriately. All right, so clothes drag. This is exactly what it says. As you can see here, this young lady has a hold of his clothes. This is a great, easy, simplest way to move the patient. You're going to grasp the patient's clothing around the neck and the shoulder area, rest the patient's head on your arms, and then drag them to safety, out of the danger zone. All right, this is a cardiac patient related clothes drag. Again, if the room in which you find the patient is not large enough, this looks like a bathroom or something, you may need to move this patient, get them out of that small confined area. Drag the patient from the tight space and quickly move the furniture out of the way, and then provide cardiopulmonary resuscitation or CPR for this patient. Blanket drag. Use this drag if the patient is not dressed or is dressing clothing that could tear very easily. Place the rug on the floor and roll the patient onto it, and then pull the patient to safety on the rug. As you can see here, on the blanket. As you can see here, this is the blanket here. Even if they're on a movable rug, you can use those. Those are pretty sturdy, so you can grab them and move them if they're on a rug that is a throw rug. Arm to arm drag. Place your hands under the patient's armpits from the back and grasp the patient's forearms. This is used to move a very heavy patient or a patient that's usually heavier than most. Offers some protection for the head and the neck. Notice that the hands are underneath the armpits and we have grasped the wrist. See that? You've grasped the wrist on each side. This is a very, very big secret about, make sure that you grab the hold of the wrist. That's going to give you all of your firm support to be able to move this patient. Firefighter drag. As you can see here, tie the patient's wrist together, get down on your hands and knees and straddle the patient past the patient's tied hands around your neck. Straighten out your arms and drag the patient along the floor. So what you're doing is you're raising yourself up a bit so it raises their head up a bit and their shoulders, and you're going to be able to move them. Emergency drag from the vehicle. One rescuer grasps the patient under the arms and cradle the patient's head between your arms. Pull the patient down into a horizontal position as you ease him or her from the vehicle. So you can see here, just reaching behind this individual, getting up underneath their armpits on that side, armpit on this side, and pulling them straight out of the vehicle and then lower them down to the ground. This would be a one-person emergent move from outside of a car. You would do this in case the car was on fire or if there was leaking fluid, any chance of that. You can get them out very quickly. Emergency drag from a vehicle continue with 2 or more rescuers. One rescuer will support the patient's head and neck, while the second rescuer moves the patient by lifting under their arms. Patient is removed with the head and neck stabilized in a neutral position, and then you're going to use a long backboard if the time permits. All right, so carries for non-ambulatory patients, so folks that cannot walk. This is a 2-person extremity carry. Rescuer 1 reaches underneath the patient's arms and grasps the patient's wrist. Rescuer 2 reaches around the legs and grasps the patient behind the knees, as you can see right here. This is Rescuer 2. This is Rescuer 1. All right. The 2 rescuers then pick up and carry the patient. Again, see how he's grasping the wrist here? Very important piece. Otherwise, they're just going to slip right out from underneath your arms and end up hitting the floor with their heads. So that's not good. So grab their wrists and make sure you hold on to them. 2-person seat carry. This is the rescuer kneeling on opposite sides of the patient near the patient's hips. The rescuers then raise the patient in a sitting position and link arms behind the patient's back. The rescuers place the other arm around the patient's knees and link up with each other. No equipment is required for this. Here's your 2-person carry. See how they have locked the wrists together? Okay, here and here. And then the person will sit down into that cradle, because this is the cradle that they're sitting down in right here, right there at the X. and then you will stand up and have them cradled, and then the patient will have their arms around both rescuers, and then the rescuers will walk from there to safety. Right, so cradle and arms carry, this is used by one rescuer to carry a child. You're kneeling beside the patient, place one arm around the back and the other one under the thighs, and then lift slightly and roll the child into the hollow of your arms. Two-person chair carry, I want to make sure that you understand you got to make sure you have a good chair. Notice that this chair happens to be made from metal. You got to have a good chair so it doesn't break on you. So something like a metal chair, something very sturdy, is very, very important. The rescuer 1 stands behind. This is rescuer 1. This is rescuer 2. Okay, stands behind the seated patient, grasps the back of the chair. Rescuer 1 tilts the chair backwards so that the rescuer 2 can grasp the front legs. Rescuer 1 gives the command to lift and walk away. All right, pack strap carry, very, very popular for a quick exiting, getting somebody out of a situation that they don't need to be in. Obviously, back into the patient as he or she are standing, grasp the patient's wrist, and cross their arms to your chest, and then pull the patient onto your back. Bend forward and walk away. Direct ground lift. This is used to move a patient who's on the ground or the floor to an ambulance stretcher. Should only be used for those patients who have not sustained traumatic injury. This is skill drill 3-1. You'll be doing this with your instructor during the skills portion of it. The steps for performing those direct ground lift are described in that skill drill 3-1 in your book. All right, so transferring a patient from a bed to a stretcher. Place the stretcher next to the bed. Loosen the bottom sheet underneath the patient or log roll the patient onto a blanket. I like the log roll maneuver because it gives you a better, sturdier surface. We use what's called a mega mover to slide up underneath the patient. It's a very good device that can lift up to 1,000 pounds. Not that you would ever have a 1,000-pound patient, but it's very, very sturdy. Reach across the stretcher and grasp the sheet and blanket firmly at the patient's head, chest, and hips and knees, and slide the patient on the stretcher. Remembering that you always should keep that patient's weight around the level of your belly button. No lower and most definitely no higher, because it's going to keep you from using your back. This is a very good representation. Here's your photograph showing the moving technique. Now notice that they've used a blanket. This is a blanket here that they've slid up underneath the patient, and they're going to move the patient directly across. Not a whole lot of space there. I mean, look at this area. I might want to get a little bit more space if possible, because there's a lot of room back here. But you know, notice that they had slid the patient over onto the stretcher. All right, walking assist for ambulatory patients. This is a very simple one-person walking assist. This is to help the patient stand. Have the patient place one arm around your neck and hold the patient's wrist. Put your free arm around the patient's waist. Grab their belt buckle. Grab their belt themselves, and then walk them to where they need to go. All right, so two-person walking assist. Useful when the patient cannot bear weight. The two rescuers are completely supported by the patient. As you can see here, you got one arm across each patient, or moving them to one place to another. All right, so wheeled ambulance stretchers. This is one of the most commonly used EMS devices. These stretchers are very, very sturdy. They're built to move patients in an expeditious manner, and a very safe manner as well. They can be raised and lowered to different heights, and they have belts that secure the patient to the stretcher. All right, so wheeled ambulance stretchers. Again, these are stretchers that can be rolled or carried by 2 or 4 people. If the surface is smooth, a wheeled stretcher can be rolled with one person guiding the head, one person pulling at the foot. If the loaded stretcher must be carried, it is best to use 4 people, 1 at each corner. They are heavy, so it's best to wheel them, but occasionally you're on bad surfaces like mud or sand, that kind of thing, that you may have to carry the patient with the stretcher. I mean, that's really not advisable. You should put them on something lighter than a stretcher. But if you don't have it, obviously you're going to make do with enough people. You need to have more people. If the stretcher must be carried through a narrow area, only two people will fit, 1 at each end. All right, so portable stretchers. Used when a wheel stretcher cannot be moved into a small space. It's smaller and lighter than a wheel stretcher and can be carried in the same ways that a wheel stretcher. Notice that it has straps on it on both ends. This is where you'll be, lifting. And if you need additional peoples, this is handled areas where they can put their hands to help out with the lifting, on each side. Stair chairs. Oh, I love them. This is an older one, but it doesn't matter. It still works. I mean, these are absolutely useful, especially when you got patients that are like up on the third or fourth floor, elevator's broken, or there is no elevator. We're going to go down the stairs. Okay. So portable. It's a portable moving device that's used to the patient in a sitting position. Very, very useful for patients who are short of breath or are more comfortable sitting. It's small, lightweight, and easy to carry. All right. Very easy stuff. Don't use for people that are not experienced or any type of patient that has trauma, because it's not a stabilization device, it's only a movement device. All right, immobilization devices. They're used to immobilize patients who have neck or back injuries. They're used to assist in lifting patients and immobilizing lower extremity injuries. Long backboards is an example of that. That's used for moving patients who have experienced some kind of trauma to their spine. It's useful for lifting patients who are in small places, and also for patients who are unconscious, unresponsive, or that are in cardiopulmonary arrest. This is your long backboard. It's made of plastic or fiberglass. Patients must be secured with straps when you put them on these things. If the patient has sustained a neck or back injuries, the head should be immobilized. So this is the head area here. This is the foot area. Notice that you have lots of handles, and on these little handles, there's little pegs. You can see this guy right here. Those little pegs are either plastic or they're metal, and that's where your straps click into for you to be able to strap the patient to the board itself. All right, so short backboard devices. This is a KED, a Kendrick extrication device. It is used to immobilize the head and spine of patients found in a sitting position. It's usually made from a plastic material or some kind of, canvas type of material with wood that supports the inside of it. Some consist of a vest-like garment that wraps around the patient. This is very specifically one of those items called the KED, Kendrick extrication device. Scoop stretchers. They're very helpful in moving patients out of small spaces, especially those that have pelvic injuries, because it comes apart in two pieces. You press this end and you press the other end. Let's minimize me for a second. Press this other end, okay, and they come apart in two sections, so you can scoop the stretcher underneath them from each side. So it's really good. This is the foot end here, and this is the head end right here. You draw a little. There you go. There's those little eyes there and a smiley face, right? That's the head end. Okay. All right. All right. So, in an emergency situation, use wide, sturdy planks, doors, ironing boards, sturdy folding tables, full-length lawn chair, recliners, surfboards, snowboards. If you don't have something to move them, you can usually find something, even if it's as simple like we talked earlier with a blanket drag or a clothes drag. But immobilization, truly, if you have to immobilize somebody, any of these items could be helpful. Treatment of patients with suspected head or spine injury. Anytime a patient has sustained a traumatic injury, suspect injury to the head, neck, or spine. So improper treatment of these can lead to permanent damage or paralysis. Okay, so we need to be careful. Keep the patient's head and neck in a neutral position and immobilize. So get down there and hold it for them. Help them out. Right, so applying a cervical collar. These are used to prevent excess movement of the head and neck. Soft collars do not provide sufficient support for trauma patients, but the harder collars do. This is a hard collar. This is a soft collar. Okay. Cervical collar should be applied before the patient is placed on a backboard. As you can see, we are doing inline immobilization. This is what this is. They're holding, manual cervical immobilization. Got somebody holding that while the other person is applying the C collar. You can see here they're slipping it up underneath the back of the neck, and then they, have it to the, front side, because once you slip this part in, that front side is over here, somewhere over here, and then they're applying it to it. This particular one is in two different pieces. And then finally, this is your end result, is that you're going to get that. You're going to strap it onto there. So they're wearing their cervical collar now. That will limit the amount of movement of the neck. All right, patients should be transported on a backboard, so they include any patient who sustained spinal trauma in a motor vehicle crash or a fall, and any person who sustained gunshot wounds to the trunk, to the chest, to the trunk area. If you suspect the patient has a spinal injury, move the patient as a unit, transport the patient face up, which is called supine, or they're on their back. Keep the patient's head and neck in a neutral position. Be sure that all rescuers understand what is to be done in attempting any movement whatsoever, and be sure only one rescuer is giving the commands. All right, assisting with shortboard back devices. After the short backboard device is applied, the patient is carefully placed on a long backboard. You're going to do that in skill drill 3-3. You'll be able to do that, apply the KED, and put them on or a short backboard of some sorts, and then put them on a long backboard. All right, so log rolling. It's the primary technique used to move a patient onto a long backboard. It requires a team of at least 4 rescuers. Movement technique of choice in all patients with suspected trauma, spinal injury. Okay. Procedure for the 4-person log roll is shown in skill drill 3-4, and you'll be doing that on your practice day for your lab skills. All patient movement commands have 2 parts, a question and the order for movement. The question should be, are you ready to move the patient? And then the order of movement would be, okay, we're going to do a log roll on the count of 3, and it should be the person at the head doing the log rolling. The patient is moved as a unit. We're keeping the patient's head in a neutral position at all times. Okay, this is a straddle lift. This would be very highly indicated if a patient has a pelvis type of injury, because you don't want to log roll them, or if there's not enough space to log roll them. Patients with pelvic injuries, this is the pelvis area right here. Okay, you don't want to log roll them with a pelvic injury, because you're going to cause a lot of damage and a lot of pain, and maybe some very, very bad bleed from the inside. So you need to be very careful with these patients. So you're going to have at least 3 people that are straddling, 1 person holding C-spine. They lift, and then another person, a 5th person, is going to slide the backboard up underneath them. Okay. All right, so that straddle lift, it does talk about 5 rescuers, 1 at the head and the neck, 1 to straddle, 1 to straddle the hips and thighs, 1 to straddle the legs, and 1 to insert the backboard. The lift should be practiced often. You guys will get the opportunity to practice that when you do your skill day. All right, so again, straddle slide. You can also straddle slide the patient rather than the backboard being moved. As you can see, the backboard is stationary and everybody's kind of walking the patient up onto the backboard. Not the easiest thing to do, but it can be done if you don't have 5 people. All right, that might be useful. And again, extremely narrow space. The rescuer positions are all the same. Lift the patient as a unit. Slide the patient forward about 10 inches at a time. Each rescuer should lean forward slightly and use a swinging motion to bring the patient onto the board. Straps and strapping techniques. Every patient who is on a backboard should be strapped down, period. That prevents them from sliding, slipping, falling off the board, all that kind of good stuff. So the straps need to be long enough to go around the board end and a large patient. Straps generally are 6 feet to 9 feet long with seat belt type of buckles, as you can see here, seat belt type of buckles. Once the patient is centered on the board, secure the upper torso with straps and then secure the pelvis and upper legs using padded as needed. As you can see, you must have at least 4 places immobilized on a backboard. The first immobilization is done is the body itself. That's the chest, okay? The legs to include what is the area of the pelvis, and then finally the lower extremities. And then the last thing to get strapped to the backboard is the head. Very, very important that you strap the body to the backboard first and then the head last. In case the patient has seizures, you wouldn't want the head to be immobilized and the body not to be. You can end up causing cervical damage if the patient is having seizure with only their head strapped to the board. All right, the blanket roll is an improvised device that works well and is readily available. That'll be skill drill 3-5, and then stabilization by the blanket roll will be skill drill 3-6. You'll do that on your lab day for your skill drills. Head immobilization must be maintained through the entire procedure. The blanket roll must be fitted securely against the patient's shoulders. Secure the blanket roll to the head with 2 cravats tied around the blanket roll, and use 2 or more cravats to bind the head to the blanket roll to the backboard. Here is head immobilization using foam blocks. These are Ferno blocks. You can see the cervical collar is on. They're placing the blocks on each side of the head, here, and on the other side of the head. And then they're strapping the head and the blocks to the backboard itself. All right, so in summary, general guidelines when moving the patient: do no further harm to the patient. Move the patient only when necessary. Move the patient as little as possible. Move the patient's body as a unit and use proper lifting and moving techniques. Have one rescuer give the commands when moving the patient. All right, so unconscious patients who have not sustained trauma should be placed in a recovery position. If a patient is on the floor or ground during the emergency situations, you may have to drag the person away from the scene instead of trying to lift and carry the person. Do not lift or move the patient if you suspect a spinal injury unless it's necessary to remove the patient from a life-threatening situation. EMS services typically use wheeled ambulance stretchers, portable stretchers, stair chairs, long backboards, short backboards, and scoop stretchers. Folks, you need to be very familiar with all of these, and on your skill drills, you'll have the opportunity on the skills day to practice those. A cervical collar prevents excessive movement of the neck. You'll be taught how to properly do that in your skill assessments. Log rolling is the primary technique used to move the patient onto a backboard. And once the patient has been secured to the backboard, the head and neck must be immobilized. All right, so as a review, the requirement of this program on every single case, on every PowerPoint, there are 21 lectures in this particular series. We have at the end of each one of these lectures, you have a review. So read each review question carefully. Then pause the video as necessary to read the questions. It's okay, you can pause it. Then I want you to open your email and type in the following information: your name, the chapter number that you're responding to, the question number that you're responding to, and the answer of that question, A, B, C, or D. And then you must give me a short rationalization for the question. Why is that answer correct? What is the information that you've learned that supports that answer? And then finally, you need to send it to or email it to us at student@emets.net. It's right up here for you. Here you go, student@emets.net. So let's take the first question. All right, review question. As an EMR, you may injure your back, even if it's straight, if you: A, lift with your back bent forward at the hips; B, align your shoulders over your hips; C, hold your hands close to your legs; D, use your leg muscles. Number 2, patients who should be transported on a backboard include any patient who is intoxicated, requestus, has an upper extremity injury, has sustained gunshot wounds to the trunk. Head immobilization is not required for all patients who are placed on the backboard, can be achieved using head blocks or towel rolls, does not need to be maintained during the backboarding process, can be properly accomplished with only special equipment. Okay, folks, that's the end of this lecture. We want to thank you for your participation in the program overall. Again, if you have any questions for your instructor, please email them to student@emets.net, and we'll see you next time. Have a good one.